Welcome to the next episode of CNMI Speaks Out. CNMI Speaks Out is a podcast about domestic violence and CNMI culture. With this podcast, we will hear stories of brave women and men who overcame domestic violence and know more about their cultural upbringing. I'm your host, Jen Taman, and today we have the privilege of hearing a story from one of our amazing counselors here at Community Guidance Center, Ms. TaAnn Demapan. Welcome and thank you for being here.
Thank you so much, Jen. Thank you for having me. It's a privilege to be on your podcast. I think you're doing an amazing job, and kudos to you and the Humanities Council and everyone that's fighting for domestic violence or ending domestic violence in the CNMI.
Awesome. No, thank you. It's my privilege. So, Mr. Ann has been in the healthcare field for over 10 years and a counselor for 2 years. And she's also influential in starting up the drug court. She was the first manager there, right?
Yes, correct. Thank you, Jen. I've had the opportunity of really holding the privilege of working with, folks that really need our help. And I'm so fortunate that I was able to help alongside Judge Quintenorio and that amazing team at the drug court, also our team here at the Community Guidance Center. I think we have folks that are really wanting to address the negative impacts of not only substance use in the CNMI, but also domestic violence and other crises that's ongoing.
Oh, that's so awesome. So I know I did a really brief introduction about you, but I know there's so much more. Can you just describe or explain what your professional background? Sorry if I didn't mention them yet.
No, thank you, Jen. So this is not a field that I just stumbled upon. In fact, a lot of counselors will tell you, and anyone working in the mental health field, that this is not something they just woke up and wanted to do. Is a lot of us are victims of something, or we just want to help. We want to address something in our past, or we could be family members of those that have experienced these issues. And so growing up, I like most women and like most island folks or individuals, I've been through a lot of trauma. So growing up, I've always wanted to be a social worker. Mm-hmm. I've always wanted to help others. And so I went to school after the military. I needed some money to pay for college. So I joined the military right after high school. I went to school, wanted to be a social worker, but in the field, I saw firsthand how my previous trauma was affecting my career path. Mm-hmm. And so when I had the chance, and God works in mysterious ways, I met my now husband, then boyfriend, in Hawaii, and I was in my 3rd year of social work school. So when we moved back to the CNMI, I had the privilege of going to NMC and enrolling in the rehabilitation and human services field. And in that concentration, there was a lot of courses on addiction. And so I immediately went for it, and I'm so happy that I'm here, and I've become certified. It took additional training and more clinical supervision and more studying on my part, but I'm very privileged to say that I'm one of a few in the CNMI that's certified to address substance use. And so prior to that, though, I was working in public health. Mm-hmm. And so everything is interrelated in terms of the healthcare field. We did deal with families or individuals that were struggling with substance use, domestic violence, and other health issues.
Wow, that's so amazing. You're so amazing. You're so inspiring. You're so inspiring.
Even more amazing, Jen. You have no idea. You're one of my inspirations.
So I know your concentration, you're a counselor here right now at CHCC for substance abuse, right? But it's been proven over time, and even I experience it, that substance abuse plays a big factor in domestic violence. Mm-hmm. Would you agree to that statement?
Yes. And before we move on, I also need to provide a disclaimer
Yeah,
that
go ahead.
I'm not an expert by any means, and some of the opinions that I will share today are not necessarily that of my employer, which is the Community Guidance Center under the Commonwealth Healthcare Corporation. It's just based on my experience working with folks struggling with substance use. Yes, I think it's a factor, but one doesn't precede the other.
Right.
Meaning, I've worked with individuals who were victims of domestic violence, where the perpetrator was not using or was not a user. And so domestic violence doesn't just stem from substance use disorder, but it does play a huge factor in it, right? And I've noticed that more than 50% of the clients that I've worked with are victims of domestic violence.
Yeah,
Or
wow.
family violence.
Yeah, that's a big number just to think about it.
It's a huge number.
Yeah.
Right? And based on my personal experience too, when the perpetrators use any substance or they morph into a different person, right? And sometimes the loved ones they can't relate to that person. They're no longer your father. They're no longer your boyfriend. They're someone totally different, and that's what the substances do to a person that already has maybe early onset of other disorders, and we never know, right? We never know why someone's aggression comes out on someone that they love.
Right. Yeah, so how much, let's say, how much of a factor is substance abuse to domestic violence?
A factor
Yeah,
in that. For me, with my clients, it plays a huge role, but it's not the only main factor.
Yeah. And then vice versa, right? Sometimes when you're a victim, or you find an outlet somewhere else,
Yes.
and then the outlet becomes substance usage, right? How much is domestic violence, how much of it being a factor?
So domestic violence being a negative health outcome, right? So what I've seen with my some of my not just clients, but also my family members and my friends that have experienced domestic violence or substance use is repeated violence over time, especially, produces health risk, right? And those health risks could regulate somebody's behavior. And so victims who have PTSD from domestic violence and other trauma turn to something else as an outlet, right? And so I've seen a lot of victims of domestic violence come through my doors seeking help, finding another outlet for them to cope with the repeated years of violence.
Yeah.
And so I think it does, not just domestic violence, but any trauma plays a huge role in someone's substance using.
Right. Yeah, I get that. Well, for me, I guess to numb my emotions when I was going through that abuse, I did use substance, and it's just to numb it. And then in some way it's so messed up, because in some way it felt like I was closer to the person, to my perpetrator, because we were both at it, right? So it just felt like we're closer. But then the denial of it, the denial that this is not healthy, and then the decisions that you're making along it, is it alters, and then you're just you now that I sit here, or now that I'm in this place in my life, I'm I made a really bad decision back then. I should have had a different outlet, right?
Yeah, but at that moment, Jen, I think most folks any individual that's in that type of setting, you find similarities with your perpetrator. And I experienced that personally, especially with my own upbringing.
Right.
Was, if you're raised in one environment and that's all you see, and that's all you think will help you cope, obviously you're going to turn to it, right?
Correct.
At that moment, it might be the only thing that you can turn to. It's not the right thing,
But
at that moment you needed something to relate, right? And that's just based on my opinion and what I've seen growing up.
Yeah, so I guess like even if you're not a victim or survivor of domestic violence or any sort of trauma, but growing in that environment, like you said, as you said, right, you experienced this through family members, right? So growing up in that kind of environment, kind of like also you need to find another outlet, and unfortunately, there are people that find substance usage as an outlet. Yeah. Okay.
Yeah, and that's exactly what substances do to you. They numb your feelings. They give you a different, feeling of euphoria. They mess with your hormones. And so instead of making yourself face that trauma at that moment, you turn to something that will numb you.
Right. Is it like a higher risk for someone that's a survivor or a victim or like who experienced this trauma to use to turn into a substance abuse usage?
I think so. And this, again, I have to always provide a disclaimer that I'm not an expert by all means. I really specialize in substance use. And I've seen it in my cases where, yes, a lot of not just the victims though, but even the perpetrators. Some of them don't engage in those negative behaviors unless they're high on something, right? So and that's why a lot of victims, I think, stay in the relationship because they see another side that's so loving and caring. But once the use starts, that person morphs into somebody else, right? Right? So
that makes sense.
There's a balance there, and sometimes we create these as victims, right? And again, I'm speaking on my own experiences where it's gonna get better. Like you create these ideas in your head that, oh, he's only drunk or he's only high. This is only temporary. Tomorrow is gonna get better. Right?
Always. We always have that mentality. It's like, oh, he'll be fine when he's sober. He'll be my boo again.
So really, the substance use plays a huge factor, and victims and perpetrators are at a higher risk of engaging in any negative behavior, not just domestic violence or it's any negative behavior if they're high on a substance.
Right. So do you believe that domestic violence is a serious issue here in the CNMI?
Based on the numbers that I've seen and being in the healthcare field for 10 years, as previously mentioned, and just my experience alone, yes, I think it's a huge problem because we are a small community. It's become a barrier. It's hard to speak up sometimes because that you're living in the same compound, or the neighbors you don't want the neighbors talking about you. So I believe that not only is our culture a positive impact on this community, but it could also be a barrier for people to get better or to survive some of these negative health or risky behaviors that we're seeing.
I know, because I've talked to some people and they're like, oh, it's hard for us to come out because they'll know our family, just it's just like the name alone. It's just like, okay. And it is, I mean, Tapan's really small, and I love that it's small, but at the same time, there's like, it's too small. We can't say what we want to say.
And we speak about this a lot. I know that you've been attending some of our consortium meetings, and we speak a lot about stigma,
Right.
and how it's affecting folks wanting to get better.
Right.
And I think some perpetrators want to get better, or some victims want to get out of that relationship, but they're stuck because they think people would judge them.
Yeah.
And in my line of work, that's been a huge factor, in a huge barrier for me to work with families and individuals that are struggling, is that stigma.
Yeah, the judgment, right?
Yeah.
Right. Has domestic violence in the CNMI changed over time? Do you think, like, just the changes over time? I know now, like, now we talk more about it. There's more awareness about it. But what do you think back then?
Jen, I think, in my personal opinion, I'm so proud of where the CNMI is. The fact that you're doing this podcast through the Humanities Council, and your partnership with DVAMS, and other agencies, and you're doing something great, and I think people really want to hear from the real experts who are the survivors, right? And so I think, in terms of changes, I see a lot more outreaches and innovative strategies like this podcast. And so I think we're heading in the right direction.
Yeah, I know. I'm just like when I think about it, when I was younger, right? It's just like I never hear about domestic violence, right? I've heard about like sexual assault on the news or whatever, but I've never really heard about domestic violence. And now that I'm being introduced to this world, I guess, I'm just like, I didn't know this happened, or I didn't know that this is available for people. And I'm just so happy that, like, anyone can get help, right? Like, there's someone out there that's willing to listen. I think that's like so important.
And more champions are coming out. Champions like you, people need to hear from the real experts. I mean, we could be the counselors, but the real experts are the victims that really need to be heard, right? And so the more people get to be a part of this, the stronger we are as a community to fight this.
Yeah, the more people talk about it, and that's our goal.
Yes.
It's like, everyone talk about domestic violence.
So kudos to whoever gave you this opportunity.
Yeah.
I think it's one of the best things ever, and you're right.
Yeah.
Maybe when we were younger, when we listened to a podcast, we would have immediately said, hey, I can relate to that. Let me go and seek help.
Right.
And so, I think you're going to reach a lot of audience, a lot of folks,
great.
individuals that really need the help and really need somebody that they can listen to. Right.
So, what do you think are the outcomes or effects of being in a domestic relationship for individuals?
Okay, so like I mentioned it earlier, repeated violence, and based on research, based on what I've studied from my schoolwork, not from any research or any formal research that I've done, and based on my experience alone, repeated violence over time can lead to other disorders like anxiety, depression, PTSD, right? And you see a lot of that even in my own family. Over time, you see that person change, right? You see them develop new health disorders like I mentioned, depression, bipolar, right? And so for an individual, it could be, not only does it affect them on an individual level, but the entire family.
You're right. Yeah.
Everyone that loves that individual, and it becomes a very lonely world.
Oh, it does. Yeah. I think like the victims, they're not just like, it's not just one individual. Like, it's the whole household.
Yes.
Right.
Anybody you're connected to, it's a system.
Yeah.
It's definitely a system, and based on my experience, it became an entire island that knew about it. So not only does it affect the individual in really, really, really sad ways, like I mentioned, you see that person change over time.
Right. So after, like, I say, you heard from a survivor and or a victim of their story, would you say that their cultural upbringing or their culture played a role as a survivor, and also for staying in the relationship or leaving that relationship?
Okay, I do want to talk about the island culture.
Yeah.
It could be I'm an islander, so I think I have every right to say this, not only based on my what I've learned, but based on what I've experienced. Is yes, I believe that the fact that we're expected to keep the family name
sacred is the
exactly
word.
You said it, Jen. Sacred.
Yeah.
And we still have cultures or cultural values or practices that really affect how we want to survive in this new world. The island culture really is about protecting our elders, protecting the family name, the traditional leaders and whatnot. And so in my experience, yes, I believe culture is definitely a barrier or a contributing factor to these issues.
Right. Yeah, because sometimes I really feel that there are people out there that wants to speak out, but I feel like they're not able to because of it's something that you have to keep behind closed doors.
Exactly. And they want you to keep it within the family, but then within the family becomes so smaller, right? You're like, who else do I turn to when my uncle doesn't want to listen to me because that's his brother, or my auntie doesn't want to listen to me because that's her sister, and so it becomes a family issue that no one in the family wants to address.
Yeah, that's true.
Yeah.
That's so true.
So then that is based on my very personal experience that not a lot of my friends and my family members get to hear about. In fact, I as I mentioned prior to us starting the recording was, I'm very careful about what I share, not only because of my profession, but because I still do love my family, right? Or individuals in my past that I know have brought me to where I'm at today.
Right.
Or contributed to who I am today.
You're right. You did mention that you experienced domestic violence within your upbringing, right? So did you tell someone about it? I'm just curious, did you ever or was it just within the family?
So a lot of people in my past, as you know, I moved here. I've made Saipan my home. I'm so proud to be a part of this new environment. But I was really born and raised in Marshall Islands, right? Then I moved to Hawaii. So you could tell this pattern of me getting away from things that I've experienced in life. And the fact of the matter is, it's really made me a strong person. I'm very accepting. I really think that it's helped me empathize with a lot of my clients because I've been there.
Yeah.
I've been there. And as much as I don't like talking about my past, I think just doing this podcast alone, I think this is the most I've ever spoken to someone about it. My close friends and my relatives knew about it.
Okay.
But not everybody that's outside of my small circle gets to hear my story.
Okay. Wow.
And so, when I heard about this podcast, I thought it was amazing. And,
Yeah.
we've done work outside of this, but, you just make me feel comfortable.
Oh,
When I
thank
see you doing it, I want to do it myself.
Oh, I'm glad. That's the goal. So, do you think that domestic violence, like the culture, play a role in how domestic violence is perceived by family involved and the community as a whole?
So we kind of
Yeah.
touched up on that, and yeah, yes, culture does play a role.
Yeah, it
in
does.
How domestic violence is perceived, and like I mentioned, not just within the family, but in the community, especially a small community like ours, where our island cultures are still strong, where we protect the sacred family name.
Yeah.
But especially now, we as a community now we want to really address it, right? And so over time it's evolved, and I think we're learning more and more about it, and how to address it as an island community.
Yeah, that's true. That's true. And I'm so glad that we're progressing in the right.
I think we are.
Yeah.
I think we are.
Thanks to Coalition, Karidat, like all this AG's office, all of this assistance that provided, right? I think we're really moving forward with, right? So do you believe that the CNMI community is responding adequately to domestic violence? I feel like we're jumping ahead of the question. I feel like, when I look at the question, I'm like, wait, we just talked about it.
Yeah, we have so much to share. Which just means that we can relate in so many ways.
Yeah, like we don't need a questionnaire.
Just so the audience knows, prior to the podcast, recording, Jen and I had like 30 minutes to talk. And, I think there's a strength in sharing stories with others that have been through the same thing that you've experienced growing up, and so I definitely think that the CNMI is heading in the right direction, for sure. Is it adequate? I'm not too sure. Being in the mental health field, I feel there needs to be more specialty. Meaning we need to hire more counselors that specialize in domestic violence, so more and more of our victims can be served. I think we are definitely responding right, but I'm not sure if it's adequate.
Yeah, right. I mean, just the TRO alone, right? Like, I've never knew there was like TRO. And to be honest, like I didn't know like we can do TRO just over like,
And just the process alone must have been overwhelming, right?
Yeah.
And then you see Karidat helps, and I've seen them attend the TRO meetings, right? And it's great to have those champions, but I think we need to have more.
Yeah.
What are your opinions about it?
I think like it's a little bit overwhelming for counselors, right? And I think we should have more just like that would help them walk through it, because when you're filing TRO and then like let's say like for me, right? Example is for me, like when I got out of that house, I never wanted to see that person ever again. I'm just like, I'm out. You can, like, I blocked you on all social media and all forms of contact with me. I'm never going to hear from you. I don't want to see you. But I also need to protect myself. So I'm going to file TRO. But the fact that I have to see that person in court again, it's very overwhelming. It's like you're reliving it. Like when you see him, it's like, man, it's not the person I fell in love with. It's more of the person that was trying to beat me up if he sees me on the middle of the road. Yeah. So I think I appreciate that people would, like the AG or, Coalition and Karidat, they come, they go escort the victims in court, but it's still so yeah. Yeah.
So going back to your question, are we responding adequately? I do believe there needs to be a lot of system changes. And we can talk about it, but we need our leaders and our policymakers to really step up to the plate and make the system more trauma informed, where we're not victimizing our survivors.
Yeah.
You know.
Yeah.
And you're so right, because I do see it with my substance use clients is, you know, they never want to see their perpetrators or someone that has been hurting them for a long time, or they never want to experience the same trauma that they went through that brought them to where they're at today.
Yeah.
And so there's a lot of system changes that needs to happen, and I do think that with the efforts of DVAMS, the coalition, and Karidat, and the Community Guidance Center, Humanities Council is stepping up. Kudos, Humanities Council. Thank you so much. I mean, we need more innovative ways and thinking that's outside of the box, so we can really make those dents in the systems that are affecting how we respond to domestic violence.
Right. Because, you know, like you said, like, it's also a trigger, you know, when you see that person again, like, especially if you're like, you're in a substance, you know, you abuse substance, and like, you go through the withdrawal and everything, and then you have court after 3 months, right, for the review, and then you're like, you get this. Sometimes I feel like, you know, I don't drink, like I never drink when I was in my relationship, but then I started drinking, and I remember like maybe the days that I saw him, I probably drank more than I usually do, because like it triggers certain emotions that are not positive. Yeah,
definitely. And you know, trauma trigger is something that we need to address together as a system, as a commonwealth, right? There's a lot, you know, and I can give you an example about, and you know, recovering from something like substance use and domestic violence could, in similar ways, you could see what the triggers are. For instance, folks who do not want to use substances, and they're trying to recover from addiction, you know, the poker parlors may be a trigger, but they're all over the island, right? And so when they drive around the island, of course they're going to be triggered. And so I guess going back to your question about, do you think are we responding adequately? I think we're heading in that direction, but more needs to be done now, so we can, you know, really help victims or survivors that want to remain in recovery from substance use and domestic violence or other issues that are affecting our community.
Right. Yeah, we should. Maybe that's our next goal for 2022.
We're trying to do it all.
Beat COVID and then do
this. On top of all of this, and you know, I guess do not edit this out. You know, I'm such a. I know that COVID and it's scaring us because it's a new disease. It's something new in our, not just in our community, but all over the world. But at the same time, I think the crisis really has been in mental health issues and, you know, all these other trauma like domestic violence, PTSD. We can't ignore that because we have a new pandemic. We need to continue the work. They need to be working simultaneously.
Yeah, that's true.
So that's my. If you need to edit anything,
no, I won't
don't edit that part.
No, everybody, we need to work. We just have to keep working, even if. Man, you know, I feel like a little bit cabin fever, because like I only go out now when I need to, and I'm just like, what can I do from home?
You're definitely doing something you can do from anywhere, which is a podcast.
Yeah, so I'm like, I need to be perfect. Yeah, like I'm just worried, like, you know, I'm on my own, and then like if I have to go to quarantine, like who's gonna watch my dogs? Like I don't even think.
Well, your audience can watch your dogs.
Like I'm like, okay, if I'm gonna have to go to quarantine, I have to like assess someone for like 3 days before they watch my dogs.
Well, the same, right? Because they're your children. Like we were talking about it prior to the podcast is, you know, what do we do about our loved ones, including our pets, if something like that was to happen. So don't worry, I think you have a huge following now.
Okay, what is it? What do you think that what do you think that CNMI community is doing right? Right, we talked about doing right, about spreading awareness or anything related to domestic violence. Like we said, like we're heading towards the right path.
Yes.
Right.
For sure, using experts in certain fields, like now we're hiring more peers in substance use, right? Having this podcast, these are innovative practices that are working and have been researched to work. Because who best to talk about this subject than someone that has gone through it or lived the life, right? And to me, I think that is so amazing that we're really focusing our efforts in the work of peers or experts that have been through. They've walked it, they've lived it, they understand it best. You could go to school for 10 years and not understand what a survivor understands or truly know.
Yeah. That's true. So what else do you think we could do to improve how domestic violence, what else can we do to make it better? Like as a community, like what else can we do?
In any work that I do, I try my best to start small, right? Look at the small things that I know we could do immediately that could make a huge impact. So they call those low-hanging fruits, And so for sure, we need the more people, especially our service providers, our law enforcement officers that are trained in trauma-informed care. I think we could start there, start at the bare minimum. More training for service providers, law enforcement officers, so we're not re-traumatizing our victims and our survivors.
Right. I also think like we should have like a 24-hour shelter.
Exactly. And I know that we have a women's shelter, but we can't ignore the men.
Yeah.
We can't ignore our other victims. There could be children that are victims of domestic violence, but we just don't have a place for them to go.
Yeah, right. I think it's important to like, if you're in a certain situation at that moment, you know that you can get you can get help and you have somewhere to go. Because I know some people, or for myself, I actually experienced like I want to leave, but I can't leave because I have nowhere to go for that night. Like just somewhere to run away. I know there's friends, but do I always bother?
Yes, and you're like, wow. And I saw this in my own experience was, at some point we stopped asking for help because we kept asking, right? But imagine if you went to a place that was readily available for you to just go and spend a night and maybe hopefully stay a little bit longer to get over the trauma that you just had, or that repeated trauma that you went through every night. So I agree with you.
Yeah.
And that is exactly what we're trying to do with substance use clients, right? We're trying to build a center, like a drop-in center, a resource center where they can go to, that's ran 24 hours and operated 24 hours by individuals that have recovered from substance use. And so I think you're right. I was talking small, but you're thinking big, and that's what we need to do. We need that. You're right.
Yeah. We need big and small thoughts.
Yes, we need big and small thoughts, Jen.
To conquer everything.
We need a balance. See,
Yeah.
I'm always starting small because I know our capacity, I know our limitations, but coming from the real experts, you can stand up and say, hey, we need a place for survivors to go long term. Karidat, the women's shelter, they're doing a great job.
They are,
but they're also very limited. We need a place where long term survivors can they can feel safe going to whenever they need to.
that accepts pets. I gotta put that in.
You're so right. They need to allow you to bring your pets.
Yeah, honestly, like dogs, like I said earlier, they're scientifically proven that they reduces stress. And like when you're in a certain trauma or in a domestic relationship, you feel alone. But when you have animals with you, you're just like, I'm not alone, and I have this responsibility. I have someone to protect. So, like for me, like, you know, I went through 8 years, right? It was abusive 8 years. But when I saw that my dogs was like being affected as well, I was like, no, hell no, you know. I'm like, no, we're filing TRO.
I'm taking you with me.
Yeah, we're gonna fight in court for you.
Yeah, that is such a great idea, Jen.
Yeah.
Maybe after this podcast, or you could do it together. Is really be that champion that heads that direction, that big thoughts.
Yeah. Well, I know there's a lot of new things coming up for 2022. I know there's like a new treatment center that's going to open, Advocacy Center with WOD. So it's so exciting.
Yes, Women of Destiny. You guys are doing great things.
Yeah.
Yes.
So, what should someone do if they were a victim of domestic violence?
Talk to someone. I think the first thing you need to do is talk to someone you trust. So talk to someone that can help you get out of that situation. I just read somewhere that recovery is not a death sentence, right? So recovering from domestic violence should not be a death sentence for anybody. You deserve a chance to get out of that.
Right, that's true. So, what is the best thing a person can do if they know someone who's a victim of domestic violence?
I think for me, what was missing from my situation was I call it real help, only because people have said they want to help, but they really don't show up, or they only help you as much as getting you into their homes for a few hours, and then
You're on your own.
and you're on your own. But I call it real help because I feel like real help should be long term in many cases, especially with this situation. Is a lot of victims just need someone to take them in, away from that environment. You can't take them in for one night and then expect them to be better, and just have a lot of understanding and patience. Because I think back then, if more of our family members were more patient with our situation, we wouldn't have suffered through that long duration of violence.
Right.
Yeah.
I think you're right. Like if the real help, like if you were to help someone, you also have to understand you're also helping the mental state of that person.
At that moment.
Yeah, not only like I feel like this also plays with substance abuse, right? Like I know, like, I don't know if this is just something I have in my head, but once you break up with someone, right, or you leave your partner, like either both partners, like they go out and drink and stuff, right? Like that's the norm, right? Like, with your girlfriends, be like, oh, we'll get you out and we'll party.
That's a scenario you see a lot.
Right.
Especially after a breakup, you're like, oh, they're getting into a divorce. Or
like divorce party. Like people actually have divorce party.
I know, isn't that crazy?
Yeah,
like that's kudos to them and more power to them. But I don't think I'll ever have a divorce party.
I don't want a divorce party. No, but also like you have to, like, I guess it's that there have to have an understanding that there's a mental, like, for the few days, like it's like adrenaline. Oh, I'm leaving this person, and then the next few days again, it's like, oh, I love that person. It's just like, and I think playing like with the mental state, like it's like sometimes that's when I feel like that's dangerous because people find other outlets, right? Like that goes, like sometimes it goes with substance or right.
That is so true, and with especially not especially, but like I said, substance use doesn't take precedence over, or doesn't precede domestic violence. or other mental health disorders. But you're so right that it is a mental health issue. You know, it's become a disorder, and and really a lot of the victims are really trying to heal from it, right? And expect them to heal overnight. I remember I still always think like, but why does she keep going back? Like, oh, I hate her, I would say things like that, because it was somebody that I loved, and so not at that young age, I did not understand, and that's why I'm in this field, is because I've learned so much about helping someone heal because of my own experiences, applying them to what I've studied. It's hard to treat mental health, right?
Yeah.
It's really one of the hardest things. It's not like physical health where they can just
Heal. Yeah.
give you diabetes medication and you're okay. You're lucky if you get somebody to remain sober or be okay from leaving that one thing.
Yeah. It's almost like
That was
an addiction.
controlling them.
Yeah.
Yes.
Right. It's almost like
Or that one person
Yeah.
that took over their thoughts
Yeah.
and their emotions
Yeah.
and everything.
yeah.
Right. So it's really a lot of understanding and patience that
Yeah.
it is a disorder that we need to address.
Yep.
Right?
Yep. It is. Okay. So, what advice would you give someone that is currently going through domestic violence?
Well, first they need to listen to your podcast. I hope that they get to hear it, because you have Jen, who's a real product of surviving and healing. If you are going through a tough time, please try to get yourself in a safe place, a safe environment, and reach out to someone you trust that can help you.
Okay. So, what would you give to someone who's seeking recovery?
Recovery from
Substance abuse. Advice for them.
for anyone is, I know we say it a lot, one day at a time,
Yeah.
but it's in my sessions with any of my clients, and they can tell you that it's really for them one moment at a time, because every second counts in their recovery. It's really hard. It's really hard to take it one day at a time, especially when you don't have a lot of the resources that other states and maybe territories like Guam do. We have 2 substance use service centers. We need to be mindful that for a lot of our folks in recovery, it's one moment at a time.
Right. That's true. Well, thank you so much for doing this. I really appreciate it. I feel like I learned a lot in the last 30 minutes or so.
I feel I've learned so much from you. Every time we get to interact, I think I learn 1 or 2 things, and you've become a part of my healing journey now. So thank you so much for having me. Sorry that I didn't say anything out of context.
No, you did fine. You're perfect. You're perfect. Well, there you have it. That's the end of our podcast for today. Ms. TaAnn, thank you so much for doing this again with me. And for our listeners out there, I hope you're able to learn a little bit more about domestic violence, CNMI culture, and substance abuse. I just wanted to share a phrase that was shared by Ms. TaAnn that really made an impact on me, which is focus on our wins, big or small, and that we can keep focusing on our past, which is very important as survivors and victims, as we try to move forward in our life, in healing or in progression. We just need to concentrate on us, on ourselves, and we can't keep looking back on yesterday and what happened to us in the past. We just have to keep focused on what we have done, focus on the things that we've accomplished, regardless of how big or small they are. For our listeners out there, thank you for tuning in with us. Please come back again on January 8th, 2022, as we talk more about domestic violence and CNMI culture. I won't be posting for the next 2 weeks, as it is the upcoming holiday. So I hope you all have a safe, healthy, and a very, very happy holiday. And lastly, if you are experiencing domestic violence or know someone who might be experiencing domestic violence, please call 911 or victim hotline 670-234-3878. Thank you and see you all again. The CNMI Speaks Out has been made possible in part by a major grant from the Northern Marianas Humanities Council and the National Endowment for the Humanities. Any views, finding, conclusion, or recommendation expressed in this podcast do not necessarily represent those of the Northern Marianas Humanities Council or the National Endowment for the Humanities.